Well, here is Dr. Kleinpell as she shares her excitement about the year ahead.
Aloha again, this is Tony Gerlach, and it's with great pleasure that I'm sitting here with the incoming president of SCCM, Ruth Kleinpell.
Good morning, hello.
And Ruth, I think it's quite interesting. You're now the third nurse who's now been in charge of SCCM. As a nurse, what are some things you want to do during your tenure?
Well, this certainly is an important time. The model of a Society for Critical Care Medicine has always been interprofessional. We received documents from Dr. Max Harry Weil's estate, and I had the opportunity to look at his first presidential address and some of those materials. And when SCCM was formulated in 1970, they actually had within the guidelines that of the 12 council members, that 7 would be physicians, but the other 5 would be designated to the multi-professions. So I think from the beginning, and also looking back, he asked Norma Shoemaker to serve as the first executive director. And of course, you know, she was Dr. Shoemaker's wife, but also a nurse. She actually served for 17 years as the executive officer for the Society of Critical Care Medicine. So nursing has really had a significant contribution within the organization. As you know, we've had 2 other nurse presidents. The multi-professional model, I think what's really one of the great assets to SCCM is we bring how we work at the bedside to our professional meetings and conferences and work groups, and that's why it really works so well. So I look forward to the opportunity to work with the multi-professional council. We work as a team and take that charge seriously.
Another way I have actually seen it is with all your research. You've done a lot. So can you tell the audience a little bit about PCORI ICU and how you hope that is going to affect some changes in critical care?
Sure. The Society of Critical Care Medicine actually received a Patient-Centered Outcomes Research Institute funding this past year for a 2-year initiative. And so we have 60 ICU teams, both adult and pediatric, across various institutions throughout the U.S. who are participating in a 10-month collaborative modeled after the Society of Critical Care Medicine's format for collaboratives in terms of the sepsis collaborative, in terms of the ICU liberation collaborative, where the teams came for a 1-day kickoff in Chicago at headquarters. They pledged to implement a patient and family-centered engagement initiative within their organization over a 10-month period. They collected baseline data. They'll have interim data in terms of patient and family satisfaction as well as clinician satisfaction, and then metrics related to their projects. So if they're implementing visiting hours, open visiting hours, what were the hours before and after, and how many families experienced that? So we're very excited about the opportunity to have a PCORI support, and also to be looking at patient and family-centered care, which we know is being embedded a lot more in our initiatives as well.
That also brings up some other initiatives that are going on, like Thrive, which is looking not only at patients and family. How is that going to be growing in the next year or so?
Well, we will actually have the report from Thrive be presented to Council for evaluation after their first year of activities. But as you saw today in the opening session, we had a marvelous plenary by Dr. Nakarni in terms of her experiences with her hospitalization in the ICU in 2015, and sharing some of her reflections back on that experience. I think we're learning as we're going. Obviously, the sites that have family support groups are having lessons learned that they're sharing, but it certainly is an area of focus that we realize as ICU clinicians that it is important, because what happens in the intensive care unit really does impact outcomes, long-term outcomes, and not just mortality and survival, but certainly their functional as well as their quality of life and psychological outcomes as well.
It's quite obvious that ICU care doesn't stop when they leave the ICU. It continues for a long road. And what can we do to best get our patients to really thrive and be the best they can be?
Exactly. We know the concept ICU without walls because we see it in clinical practice.
Yes, we definitely do. On the flip side, similar to that seems to be all your initiatives, at least on social media following you, is Burnout, and what we do as clinicians? Because sometimes when you see these horrible stories, we've both been there, it does affect you. So what are you working on with some of these burnout issues?
That's another exciting initiative that we have ongoing. I just came from the Critical Care Societies Collaborative, the CCSC, large response in terms of audience, and we had presentations on some of the updated research. There was a new meta-analysis published in Lancet last fall that looked at the interventions that are out there. They're both organizational as well as individual in terms of preventing burnout, whether it's through yoga or meditation or exercise. And the impressive thing about the session is the line of individuals that came up to the microphone. We intentionally scheduled it to be a 2-hour session, an hour of basic overview, and I had to leave them because the discussion after an hour was still going. But I think that's confirmatory that this is an important topic. And I told the group, this morning, that was the first session after plenary. There were 9 other concurrent sessions that could have gone to, and they chose to come to that one. And we polled the audience in the beginning, and 3/4 were physicians. So it really is a hot topic. They were sharing some examples of things they're doing in their unit, peer support, mindfulness, scheduling changes. And the other topic that was addressed is really having it embedded in our training of our residents, our fellows, our nursing students, our pharmacy students,
of course,
so that they have awareness, because that was something that was never given to us when we were getting our education, but yet it's a reality of working in a high-paced, stressful work environment is to have awareness and then to take measures to address that stress.